maybe what your major is and kind of your future aspirations, and just like I don't know, a couple, like a sentence or so. Why don't we start over here?
Hello everyone, my name is Roxanne. I am a third year major here at State, and then my major is pre-health right now. I want to go into nursing, so I'm just trying to finish up my prereqs for nursing program there at State.
Thank you.
Hi, my name is Nicole. I'm a third year as well, and I'm majoring in pre-health and aspiring to be in the nursing program.
My name is
Cassandra.
Tiffany. I'm a first year bio major.
Go to
and I'm
the
on
Tribute Instagram. There's that YouTube link. Click it. Is the audio working though?
I'm in my 4th year and
Step
I'm in
outside.
pre-med.
It's delayed by like 5 seconds.
Okay.
Wait until they start talking.
Good.
Sorry. My name is Andy, president of Tri Beta, master student, kind of PhD path, and I guess that's it for me.
My name is Cassandra. I'm a third year biology major on the pre-med track.
All right. Sounds good. Sounds really good. Well, thank you very much for introducing yourselves.
That's
So,
it.
one of the things
You can hear them
we were
clearly?
asked to come to present here, and this is something that I definitely feel, we both feel very strongly about. We come at this from a little bit of different lens. I have a master's in public health, so my area is in health education, health promotion. But I did my graduate project in patient-physician communication, and all of that. We feel like this is really an essential life skill, is knowing how to navigate your own healthcare, and then obviously being able to impart that to others. We also recognize that there are some common challenges, so our hope is that we're going to be addressing some of these. We understand that sometimes insurance can be very confusing, even for myself, and I've had insurance for years, and I've navigated myself. I've navigated it for my daughter, who has a couple of major health issues. It's still confusing. So we'll do our best to to at least get you on the way. It's sometimes you don't know where to go, and I know there's also a lot of fear of costs, and how that impacts us, how that impacts you as a college student. And one of the most important messages that we want to say here today is that you know you, and that's really important. You are an expert in yourself, and so you are the best person to advocate for your healthcare needs. And we feel like that's really important, is to remember that. Some people are really good at knowing their body, and they know when things might not be working right, and others of us, like myself, sometimes go through a little bit blind, and then are like, wait a second, that is a pain, and I probably shouldn't even be having that. Maybe I need to check in with my doctor or my nurse practitioner about that. So, but the question that I have for you is, how many of you have ever made your own doctor's appointment, just by raising your hand? Okay, so some of you. Okay, and I ask that because when you're in college, oftentimes this is the first time that you get to navigate your own healthcare. And I have a 19-year-old, and I help her a little bit more because she's got some complications. But I remember myself at 17 starting college, and oh my gosh, I've got to navigate this. And so it's still the same today. And so we challenge you, if you have not done this, we challenge you to do that.
So one of the things that I hear pre-nursing, pre-med, when you're out in the real world starting your careers, you're going to feel like, why didn't I take some kind of course in insurance? Because you will have to deal with insurance throughout your career. The other thing that you're going to find is when you're the health professional in the family, everyone's asking you questions. You won't even have your degree yet, and they're going to say, hey, I got this rash. What do you think it is? You know, you're going to get this from family and friends all the time, and consequently you will also get insurance question issues, like you're supposed to automatically know this. So what our intent today is to give you some maybe skills for navigating the insurance world, some skills knowing how you go about a doctor's appointment, what kind of health history do you need to know about you. And once you're more comfortable, as you've had practice going on with your life, then you can be a resource for others when they have these questions about what is a code. You personally or for friends and so forth, Medi-Cal is the state insurance program. Many individuals are on that. It is different than private insurance. Private insurance has its own rules. But with the state Medi-Cal program, many times it is county specific. You can only receive care based upon the county that the Medi-Cal has been assigned to. So let's say you are from Ventura County and you're under your parents' insurance, and it will be Medi-Cal, and they have Medi-Cal. It's Medi-Cal for Ventura County. And you come up here and you want to continue seeing, you know, someone up here because you have asthma, it's taking too long to get into student health, whatever the case may be. You will not be able to use your Medi-Cal when it's assigned to a different county. Many times, pharmacies will not accept your insurance if it's in a different county. So you all need to know, if you're under the Medi-Cal plan, what county is my insurance attached to. And if you find you have been assigned to a different county, do you want to move it to Fresno County? Then the questions you need to ask yourself is, what is my life? If my life is school when I have to be here, then Christmas break, spring break, summer break, I'm at home, you're probably not going to want to transfer your Medi-Cal. But if your life is, well, I've got a job now, you know, and I'm working at the mall, and yeah, I plan to work over the summer so I can make some money. If you're in, for all intents and purposes, living in Fresno County, then you want to transfer your insurance to Fresno County. If you or a friend has that need, the way you would do it, you would simply Google right here, how to transfer Medi-Cal to another county. And you basically work with both the county Medi-Cal office where your insurance is assigned, and you work with the Medi-Cal office for the county you're transferring to. This is not a difficult process, but it does mean you have to take charge, get on the phone, talk to individuals, and sometimes the wait can be a real pain. But there is a resource. You don't have to feel like you are stuck. And let's say you finish up here, and then you go to LA County, and you're, you know, not employed yet, you're back on Medi-Cal, then you can transfer from Fresno County back to LA County or Ventura County, whatever the case may be. Transporting your Medi-Cal type of insurance is very common, and so it takes you doing some legwork on your own. Okay. Next slide. So types of healthcare, I talked about that there are lots of different types of terms. So when someone someone talks about primary care, what they're capturing is general physical exams, general checkups, preventative care, doing your pap smear, doing testing for sexually transmitted infections, dealing with your asthma. If you have a chronic condition like lupus or high blood pressure or diabetes, it's that as well. That is primary care. When you talk about urgent care, if someone tells you you need to go to urgent care, that's kind of like mini emergency room, so to speak. You're dealing with minor injuries after hours, especially if you're talking about getting most of your health care from student health. If something should come up, you are riding your scooter at pitch black and the light is out and you hit something, off of the sidewalk and you fall head first, and really have this bleeding head and you think you maybe have a concussion. That is urgent care or emergency room where you would go. Emergency room, generally life-threatening emergency. You cannot breathe correctly. Emergency room. You hit your head like I talked about, you are unconscious. Person needs to go to the emergency room. Okay, so a higher level of urgent, emergent type of care. And then there is specialty care. Mental health therapists, psychiatrists are captured under the mental health component. Specialty care, like a dermatologist, someone who just specializes in skin disorders, endocrinology. OBGYN, many times we think that's a specialist, but for most insurances, if you were not aware, they actually deem OBGYNs under the primary care umbrella. And what does that mean in the big term? Many insurances, when you are wanting something special, you want to see a dermatologist, for example, you have to first go through your primary care provider and get a referral to the specialist. Since OBGYN is not a specialty, you yourself can make an appointment with an OBGYN. So that's kind of the difference. Does that make sense? Where does the Student Health and Counseling Center fall? What do you guys think? Are we an emergency room? I want everyone to say no. We are not an emergency room. Because I've had some people come in, I'm thinking of one person in particular, was actually a much older gentleman, multiple health problems, fell and hit his head, and was irate when I said, we cannot provide care for you here. You need to go to the emergency room. You have these risks, you need a CT scan, and blah, blah, blah. We're not an emergency room. Are we primary care? How many, we asked who's made appointments. Who's gone to the health center? No one's gone to the health center. No wonder they don't know what the answer is. Come see us. We'll love to see you. We're considered actually a combination of both primary care and a little bit of specialty care as well. So yes, if you have, what is this rash? I need someone to tell me what's going on and how to treat it. That is us. If you have asthma, we need a refill on your inhaler because you, over Christmas break, left your inhaler at home in Ventura County. I don't know why, Ventura County today. You come and see us. We can do physicals. You're off in the world now on your own. Mom doesn't have to make appointments. You know there's a strong family history of diabetes or high cholesterol. I kind of want to know, am I at risk? What's going on? What do my lab tests show? You come see me at the health center, make a physical exam appointment, and we'll talk. The student health, though, does offer some specialty services. We do have a dermatologist that comes in once a month. You would, again, need to see one of us, the primary care providers at Student Health, and then we can make a referral if necessary to dermatology. We have have mental health services. It's student health and counseling center. We have psychiatrists on board. We have many therapists on board as well. And we'll be talking about our specialty services a little bit more later in the presentation. So we put up here some of the possible issues that someone maybe would experience. And now that you know a little bit about primary care, urgent care, ER care, specialty care, tell me what the answers are. If you're wanting birth control, who are you seeing? Primary care. That could be OBGYN under primary care, but we offer that also at student health, if you were wondering. You hurt your ankle. Urgent care, possibly. It may be student health. If you hurt your ankle and there's a bone sticking out, that's not even urgent care. That's emergency room. If you fell, twisted your ankle, and you're kind of limp walking, you can be evaluated at student health or your primary care. Many times can take care of that. Urgent care if it's after hours. Depression. Student health for the counseling services, yeah. Again, based upon what you're, so let me ask you this, do you all know that you have insurance, yes or no? I don't even know the answer, but just answer in your head. Do you know what your insurance covers? Maybe. Okay, some insurances cover mental health options. I can speak for myself, Kaiser has mental health services, but not all insurances do. So one of the other things that you need to do as far as taking charge of your health or giving advice to other students and family members is to know what your insurance covers. Because with depression, yes, it's a specialty kind of service as far as counseling therapist or psychiatrist. You don't have to come just to student health. You may be able to make an appointment on your own based upon your insurance. Flu symptoms. Primary care. Severe chest pain. Yeah. Yes, exactly. Severe chest pain. Your grandpa's having severe chest pain. It's calling the ambulance and ER. Someone who's 18 having severe chest pain because they just got hit in a football game, maybe urgent care, maybe not necessarily ER. So you have to look at the circumstances. Always when something is severe, default to the ER if you're in doubt. Treatment and testing for sexually transmitted infections. Primary care again, yes. OBGYN or primary care. Those are, and also an option that we have at student health as well.
Guys? Okay, so I'm going to talk to you a little bit about Insurance 101, and I think that Sandra's done a great job of really kind of launching into it. But some of the terms, just that you might want to be familiar with are terms like premium, deductible, copay. Anybody know what a PCP is? She was saying it quite a lot. Primary care provider or primary care physician. At the Student Health and Counseling Center, our primary care providers are both physicians and primarily nurse practitioners at the Student Health and Counseling Center. A PPO, Preferred Provider Organization, that's a type of insurance. An HMO, Health Maintenance Organization, that's another type of insurance. So for example, HMO, Kaiser is a perfect example of a health maintenance organization. Oftentimes at Kaiser here, it depends, we've got various setups, but a lot of times you go to like the main campus and you've got a lot of different resources there. In addition to the hospital, but you also have provider offices and things like that, but then they've also built some other places too, I know. I used to be part of Kaiser. PPO is where you, it provides you a little bit more freedom than maybe a health maintenance organization, in that with a PPO, because I'm part of that, I can go to like specialists without getting a referral from a primary care physician, although what I'm noticing is more and more they want us to go to a PCP before we go to a specialist. But it provides you a little bit more flexibility. Things like premium, does anybody know what a premium is? Have you heard this term before? I kind of liken a premium kind of like a membership, like to Costco or something. So it's really the amount, I'm gonna read it here, the official definition is the amount of money paid by the insured to the insurance company for the insurance policy. So basically you do a premium, you pay a premium, sometimes it's once a year, sometimes it's twice a year, but it entitles you to use the insurance. Oftentimes with premiums, especially when you're employed, your employer will pay part of that and you pay the other part. Depends on your, on what you do though. If you're like a physician, if you're a physician and you go to several different, you don't work under one umbrella, like one individual, then you pay your own premiums. Depends on how you're employed. Attorneys and other people that are in their own businesses, sometimes that works a little bit differently. Now the term deductible, that's the amount of money a policyholder must pay out of pocket before their insurance begins to pay. So for example, you know, if you're going to take advantage, let's talk about mental health. Sometimes with mental health services, you may have a certain amount of money that you've got to pay out of pocket before then the insurance company says, okay, I'm going to pay part of that. And that's true really with so many different services. And again, your HMO, it's going to be a lot more reasonable than if you go to a PPO where your deductibles are higher typically. The term copayment, because that's oftentimes what you hear. It's a fixed amount a person pays for a covered healthcare service, often at the time of service. So you may pay a copay when you go to your doctor's office. For my PPO, when I go to my primary care provider, it's $20. When I go to a specialist, it's $35. But then what happens is your specialist or your primary will bill more for that particular visit, then that's billed to the insurance company. My insurance company, if I met my deductible, will pay the rest of that visit up until what's customary. Well, anyhow, we won't get there. It gets so confusing. I mean, even for us that have had it for a number of years. But you also do a copay. You pay a copay at your pharmacy or at other specialty services, like for example, physical therapy. And then it's also understanding the difference between the Student Health and Counseling Center, private insurance, and Medi-Cal. Now, we already talked a little bit about private insurance, whether it's Kaiser, I have Blue Shield, PPO, there's Medi-Cal, which Sandra talked about really is the state insurance. The Student Health and Counseling Center, though, you do not have to have insurance to use the health center. You guys, through your tuition here at Fresno State, pay a mandatory health fee, which entitles you to use the health center. It's almost like a premium. You pay a premium that entitles you to use the health center. Most of our services are free, but there are things that cost. Different, you know, if you have to have some vaccinations or things like that, there's often a cost associated with that. Or some lab work. But we really do get things at a state rate, and so it's pretty reasonable. Even if you have health insurance, maybe under your parents or what have you, but you want to go and get a medication, excuse me, from the pharmacy, you'll often find that that's cheaper than doing your copay through your parents' insurance. Now, we do not accept insurance, but what we can do for many services is provide you with like a receipt or an itemized receipt that you can then take to your insurance to see if they'll cover it. But we really always tell people that, you know, come to the health center, you're already paying that mandatory health fee.
Exactly. And again, so prescriptions you pay for, but also any over-the-counter medications. And since we're entering into cold and flu season, stop by the health center, go to the pharmacy, it's right at the front, pick up cough, cold medication, Tylenol, ibuprofen. A bottle of 100 ibuprofen is like $2, okay? So this is the prices that we're talking about. We charge the students cost. So we're not adding on $10 to make profit. The Student Health Center doesn't make a profit, it's a nonprofit type of situation. So many of our products are very, very reasonable. I have many students who are under their parents' insurance. They want to have a private service. For example, they want to be on PrEP to prevent HIV. They don't want their parents to know about it. They get their medication from the pharmacy. They maybe pay $15 or something like that. Someone wants birth control pills. They don't want their parents to know about it. Yes, you'll have to pay out of pocket, but it's $15 per month of birth control pills. So we have a lot of students who, even though they have insurance, they just want to keep things completely private from their parents and use our services for that as well.
Understand that your medical record belongs to you. And we'll talk a little bit more about that, but that's confidentiality and all that is really critical. We are bound by HIPAA just like any other medical clinic. We don't like share your medical records with like your academic side of the house. So, and the tip also is always make sure to carry your insurance card if you have insurance, or if you have Medi-Cal, carry your Medi-Cal card, but also know your student ID, because your student ID number will entitle you to use the health center, or will allow you. So, this is our scenario. How are we doing on time, by the way? We're good, okay. So this is the scenario that we have around insurance. And I don't, did you want to specify what type of insurance, or are we just gonna?
Well, let's just throw it out. So you want to see a dermatologist and you have an HMO insurance. Do you have any idea how you would proceed?
Primary care, or like someone like you guys, and then get a referral.
Right. So the example Kathy gave for an HMO was Kaiser. Kaiser has obviously primary care and lots of specialties within the Kaiser umbrella. So you would see your primary care and then get referred. HMO is one insurance that we at the health center are not able to refer to an outside provider. So for example, if you came to see me, you wanted to see a dermatologist, I find out you have Kaiser, I'll tell you, you have two routes. I can either refer you to our dermatologist who comes one time a month, or you have to see your primary care at Kaiser and go that route. So you know, if you're going home for Christmas break, probably the quickest for you to follow up with Kaiser.
For my insurance with a PPO, I actually make my own dermatology appointment. So I just called her directly and scheduled that appointment. So I didn't have to go through my primary.
Right. But like Kathy mentioned, some specialties are now wanting a referral. So you heard what Kathy said, you look at your insurance card, PPO. I have been dying to go see, I don't know, the psychiatrist or something. So I'm gonna call, I don't have to have a referral. You may find on the phone, they'll say, what's your insurance? So you can see here we have medical services, immunization, pharmacy. We offer specialty care. We offer medication abortion. We offer pre-exposure prophylaxis, PrEP, that's for HIV prevention. We offer gender affirming care. If you are a trans individual and are interested in starting hormone therapy to achieve the gender expression that you know you are, then that would be hormone treatment, and we offer that. Dermatology services, as I've mentioned, and we offer endocrinology services, all under medical. Mental health services, counseling, we have a hotline. Call says, my daughter said they were at the clinic and you gave her birth control. I'm going to know what's going on. By the HIPAA parameters for that type of service, your mom can't find out anything. I can't even acknowledge you were at the clinic. Where your parents could potentially find out anything is if you have given them access to all of your login passwords. Insurance billing. I mentioned this a little bit with the other scenario. So again, you want to see me, you want to get started on birth control, you have insurance under your parents. Why can't you use your insurance so you don't have to pay that $15? The problem can arise, and again, I'm not an insurance expert, it may not apply to all insurances, but where the problem arises, where there could be a potential issue for you, is the person who holds the insurance. For example, let's say your mom is the policy holder for the insurance for the family. Your mom is going to get a benefits summary periodically, once a month, once every 4 months, something like that. And it will indicate every single service where the insurance is billed. So your mom's looking through this, and it shows that you went to CVS on November 18th and the insurance was charged $80. And she's like, I didn't go to CVS on that day. I was, visiting your grandmother in LA or whatever the case may be. And ultimately it may come back to, did you use CVS? What did you get at CVS on November 18th? Doesn't say you picked up birth control pills, doesn't say anything like that, but that's where potentially there can be a breach in your confidentiality, okay? And like I said, that's why many students just want a clean slate, no connection with the insurance they have and the services that they're receiving with student health. Okay, nice, I already mentioned access to passwords. Okay, how to make an appointment. Kathy's going to pull up how you would do this. So the first step is you have to get onto the Student Health and Counseling website for Fresno State. And My Bulldog Health is your chart, your medical chart. And you press Login Now. And you would use your routine account information that you log in everywhere. Do you have? Okay. I'll do
You know this much better than I do.
And then you're going to get the dual push thing. I've already been logged in today on the student health site, so it should not need to have me repeat that, but obviously it's having issues connecting. What I want you
You have to
see,
check it.
Huh?
It wants you to check it. It wants you to do it.
Oh, check. Ding dong.
Yeah.
Okay, you guys, would you do this all day long. Okay. Okay, now you're on the home page. I happen to have an actual chart on my Bulldog Health because I was captured when they went to the electronic medical records while I was getting my doctorate degree. So, appointments. You would click on appointments. I tested this out yesterday since I'm no longer a student. I can't make an appointment, but you would click on appointments, and you would then have the steps on making your own appointment. You can do it online. Some appointments require you call the front desk at Student Health, and this category will show that to you if that's necessary to actually make your appointment. This right here for your My Bulldog Health is very important. Let's say you see me, you had a cold, you forgot to ask me for a medical note because you missed your test. You could call the front desk and say, I need a medical note, they'll send me a message, and then I will drop your medical excuse under the category letters. Okay, so you have to see this drop-down menu, and many times when you're on a phone, this area here does not populate. So you would look at the 3 gray lines that would be up at the top if this had not dropped down, tap that, and this drop-down menu shows up. Like I said, it's especially an issue on phones. On computers, not so much. If you have blood tests with me, you see me for a physical, you have blood tests with me, you're going to get a message sent that I have sent you a message. You go here, not where it says messages, you go here, open it up, and I'll be explaining all your blood test results. So this is what, in a very short way, what your My Bulldog Health chart looks like. Does anyone have any questions on that? Now I know, I think you're the new person who came in. Previously I'd asked, has anyone been to Student Health? Have you been to Student Health? Okay. Yay! One of you. One person. Now, do you have any words of wisdom then about getting onto My Bulldog Health or navigating, making appointments, anything that you want to share?
No, not necessarily. Other than if you do make an appointment, just make sure you check in 15 minutes early. That's been like a consistent thing for me, like making sure I'm there early so that you don't get the late fee. I think we haven't gotten the late fee yet. It is a little intimidating to sometimes call for appointments, I will say, but it's really just like a quick call, and it's not as like scary as you think. I only utilize one kind of service from the health center, so I don't know how it is for others if you have to call or not, but it's not as intimidating as you think, and they're actually really helpful. Actually, I'm a big fan of the health center. So.
Well, thank you, and thanks for sharing, and thank you for mentioning getting there early. You schedule an appointment for 2 p.m. It's like, okay, I'll come in at 3 before 2, right? No, you're going to possibly be charged a late fee. You need to be there at 1:45. So to me, it's like, why don't they make your appointment for 1:45? But I've only been there since 2019. People who have been there 100 years say, this does not work that way. So whatever, I can't change it. So yeah, always 15 minutes before your actual appointment time. Thank you for bringing that up because I had not mentioned it.
Okay. All right. So, being your own health advocate, and I guess I want to just ask the question: what does it mean to you to be your own health advocate? What have you maybe thought about for yourself? Maybe going into practice. What do you think it means? Yes.
Taking charge of like your own priorities and like how you're doing, just checking.
Okay. Okay. Yeah, looking at your priorities, taking control. Okay. Anything more specific? What does that look like?
Identifying kind of potential issues that you have down the road because of any like family history that you have. So identifying those potential risks and being proactive about it. So if you know you have a history of like high cholesterol, getting those labs done early, seeing if your cholesterol is the same, and just identifying personal things that you want for your health in the future and taking control of that. now. So
Excellent.
things before.
Thank you. Anything else? I know most people have the answers, but I'm going to pop in a few. And one of the things that we're getting kind of narrowed down as far as one of the things that we talk about is preparing for your visit ahead of time and preparing your questions. Because I know for me, sometimes especially if I'm going to have some kind of procedure and the doctor's going to give me some kind of result, sometimes when you get that result, your brain is thinking of all these other things. Or sometimes you knew all the things that you wanted to do or when you wanted to ask the provider, but oh my gosh, I forgot my list. And you walk out the door from your appointment and you forgot to ask. Sometimes you have relationships where you can send email messages to your provider. It just depends on the situation and the relationship. But being prepared ahead of time, that's part of taking control. Being honest about symptoms, and that's another thing we talked about. You know you, and you know yourself best. And one of the ways that a provider will to identify maybe what you're dealing with,
Maybe even give a diagnosis. Part of that is for you to list out your symptoms. They're looking to find out what are your symptoms, because that's really ultimately going to help them piece the puzzle together. And if you're not honest about your own symptoms, then how can you get the treatment that you need? So understanding again the confidentiality. The other thing that I like to throw in here oftentimes is that relationship that you have with your provider. A lot of times people don't realize, especially as they're new to this, is you can request a provider. So for example, say you feel more comfortable with a female or somebody that identifies male, or maybe somebody, if you're Latina and you want to see somebody, again, that's an important thing, because sometimes you feel like you can maybe identify with that person. And so I always like to say that, be aware of that and understand that you have the right to that. We're going to talk a little bit about rights and responsibilities. And ask about costs, tests, and follow-ups. And that's important. What is this going to cost me? What are the things that I'm going to have to do? What kind of tests are you going to run? Will this hurt? Will this, whatever you want to ask. Follow-ups. Do I have to come back to you for results, or were you going to call me for results? Those kinds of things. And know your treatment options. And one of the things that we talk about is, providers should be giving you their recommendations on how to proceed. So let them ask them, what are my treatment options? What do you think? What are you suggesting are my next steps? And know your rights. And in the folder or the little bag that we're going to give you, we are going to provide you with your list of patient rights and responsibilities. And understanding that you are the consumer. So you have the right, and I won't go through all of these, but just a few things. You have the right to be treated with respect, consideration, and dignity. You have the right to privacy and confidentiality with regards to your treatment and medical records. Your medical record is completely separate from your academic record. We get questions about this all the time at the university. And approval or refuse the release of your medical record. So you have the right to approve or refuse the release of your medical record, except when release is required by law. So you do not have to release your medical records to your parent, say, or your spouse. And then responsibilities. These are things that are your responsibility. Presenting accurate identifying information. Present details of the illness or complaint in a direct and straightforward manner. And so again, you know you, and so that's really important. So those are some of the rights and responsibilities, and being mindful of those. Did you have anything you wanted to add into anything?
Yeah, I did. Know your health history and your family history. I don't know how many times I will ask brand new patient, do you have any health problems? Usually, students are able to give me a clear answer there. And then I'll ask, have you ever been hospitalized? Yeah, at 2 years of age, I was in the hospital. What for? I don't know, but I know I was in the hospital. So those types of things, if you have heard mom say something like that, say, what was that for? Or you have a scar somewhere on you and mom says, oh, that's when you had your surgery. What are the details of that surgery? This is all very important information, you know. Maybe that scar, for some reason, you had your appendix out when you were 3 and you never remembered it and you're having abdominal pain. Medically, I'm thinking always of appendix issue, and you may not even have one. So we need that piece of information. And again, kind of know your health. Did you have asthma when you were a kid? You know, have you ever had a concussion when you were little that you don't know about? Know your own health, because if no one's ever told you, in medicine, what you tell us is probably 80% of what's going to make me make a diagnosis. The physical exam and lab test, they're like 20%. We put the pieces all together to come to this conclusion, but the history is absolutely important. And like I said, probably even more important than the physical exam in some ways. So we're almost coming to the end here. So we wanted to go over, what does staying healthy mean to you? What again, shout out, this is casual information here. Go ahead.
Taking care of yourself properly by eating right, sleeping, physically, mentally. It's just as we self-care, love self-care of yourself.
So you've hit the nail on the head. How much sleep should you be getting?
It's 8 or 9 hours.
Yeah, exactly. I mean, I have so many students say, oh, I'm getting 6, isn't that enough? And then they have, you know, a concern about being tired all the time. Yes, you're going to have some late nights, but don't make it late nights 5 days out of the week and you sleep well 2 days out of the week. That's not good enough for me. Regular checkups as well. Your colleague here mentioned, you know, if you know there's a strong family history of high cholesterol or diabetes or personal history for you, you need to go in and get lab testing to know where you're standing and what your risks are. Vaccines, staying up to date with vaccines is also a very high priority in keeping you healthy. This is where you have responded: sleep, nutrition, exercise, stress management. I know when you're a busy student, it's, you know, getting in some exercise is kind of the last thing that you're thinking about when you have everything else you're juggling. But you're setting patterns for how you're going to live the rest of your life. Because being a student is busy, being an employee is busy. Then you put being a parent on top of that. So you're going to have to learn how to juggle all this that is on your plate and still carve out me time, okay, because you need your own mental health, and some physical activity. Stress management, many times exercise can be the stress management option as well. So healthy habits now to last your lifetime. Staying healthy also means sexual health, being on birth control so you don't have an unplanned pregnancy that derails your college plans. Staying sexually healthy with STI prevention, using condoms, committed relationships. And if you are not in a committed relationship, you know you're not always going to use condoms, then you're coming to see me and we're going to be talking about PrEP and something called DoxyPEP. PrEP, of course, is for HIV prevention. DoxyPEP is an antibiotic that is used in a certain way to reduce your chances of getting chlamydia, gonorrhea, and syphilis. And then many sexually transmitted infections have no symptoms, so unless you're tested, you don't know that you've been exposed. So the recommendation for those in the room here under 24 and under is once a year testing when you're sexually active, even if you're in a committed relationship, and more frequently if you're, you should have a partner change, or if you have worries that your partner is not faithful to you, come in and get tested.
so if it's positive, you can get treatment. And I think there's one more item here
There
we'll fall
is.
through. And part of your medical health journey going forward, now that you're adults, is keeping your own personal medical records. You all should have your immunization card with you. If you don't have your immunization card, if testing was done, blood testing was done to determine if you were immune to measles, mumps, rubella, varicella, keep that lab paperwork. That's your immunization card. If you had lab tests, you're going to be graduating in spring of 2026, you had lab tests. Make a copy of your lab reports. You can do this on your own through your My Bulldog Health portal, so that when you see your next primary care provider, they know what your baseline was. So keep your medical records going forward.
Okay. So just, kind of wanted to end this presentation with a couple of resources for you in your bag that will address some of the things that are on the slides. First of all, this is the Thrive at Fresno State, and we kind of again look at your use of the health center, and you've already paid a premium to use the health center through your mandatory health fee, and this really goes over a lot of the different resources that we have, much of which we've talked about. One of the things, we didn't spend a lot of time talking about wellness services, but we've got a lot of different resources there for you to take advantage of. So just want to make sure you're aware of that. Got your rights and responsibilities that I referenced. This is, I wanted to show you, and Sandra made reference to our therapy groups. In addition to individual counseling at the health center, which sometimes can be impacted, we have a lot of different therapy groups, many of which students can just pop into that are relevant to maybe what you might be experiencing. So understand that these are resources. They're run by our licensed therapists, and if anything appeals to you, you can always call the health center or come by and say, hey, I'd like to pop in to one of these. Do you usually encourage people to just pop in?
Yeah.
Yeah, absolutely. And then there's a couple of the resources, again, about counseling. Let's Talk. Let's Talk is, it's online support from 9 to 4, Monday through Friday, and it's help via Zoom. You do not have to show yourself on video. You do not even have to put your name down. Maybe you have a question, but it's a licensed therapist that's going to be on the other line that could answer a question. And maybe the two of you decide, hey, maybe you should come to this group, or maybe you should come to counseling. But that's something that the two of you will discuss. And then we've got, this is new, Are You HIV Possible? This is a card that talks a little bit more about PrEP and the resources that are there for you. Let's see, if you haven't used our wellness vending machine in the RSU, by the way, little news is we got approval to put a second wellness vending machine on campus. Many of the resources are free or, again, very low cost, like the pharmacy. This is our Keeping It Sexually Safer. So we've got grab and go condom bowls all over the campus, but students can also request kiss kits, specific information that or specific resources that they might want, and this is all for free, and it's very discreet. So we like to let students know about that. After hours care. So if you call this number, our health center number, maybe you have a medical question, we will have a nurse. There is a nurse line attached to this, but there's also a therapy line. So these are resources for you as a student. So just be aware of that. And it's nice little handy dandy, you can put it in your wallet. And then this is a resource that we have. It's a student guide to mental health and well-being. So this is something that's online. There's a QR code that'll take you to that. And last but not least, a shameless plug, because this is an event that I'm planning. It's our wellness fair. So again, this is a way for you to maybe start your journey into health. And I am working with a group of public health students that are going to have informational tables on a lot of different things. But because this is on December 3rd, right near finals, we will have therapy dogs, we will have chair massages, and a lot of different free prizes that you can win. So that's kind of a general a general overview of things. And if you have not scheduled your first appointment at the health center, why not?
What questions do you have? Go ahead.
Someone in the chat had a question. How many times does the dermatologist generally at the health center?
1 time a month for 4 hours. So if you were to see me today wanting a referral to the dermatologist, I would say we're looking at January at the earliest, because I already know that the schedule is full for both November and December. Any other questions? What did you guys learn?
Really great information about what you guys have to offer and how to make appointments as for someone who didn't know and how to navigate all through it.
Good, good. Well, that was our intent. Anything else? Okay. Well, for me, I'm happy that you got to share a little time with us and learn a little bit about services and about insurance and so forth going forward.
Yeah, and I just love to meet you all and love when your colleagues share information with each other. I think that's the most impactful of any of this information. But hopefully we'll get to see you in the health center, and good luck with your midterms, and happy Thanksgiving, and hope you have a little bit of break in store. I know a lot of people take the time to work during that week, but
Yeah.
hope you get a chance to relax a little bit.
And thank you.
Thank you so much.
Okay. So we'll be taking this.